as well as a health right activist. Thank you very much.
Dr. Ganapathy, thank you so much for kindly calling me Dr. Revank Reddy. I really am not a doctor. I'm an IT professional, but let me quickly bring up my PowerPoint. First of all, thank you so much, Dr. Ganapathy, for having me today, and also the organizing committee, consisting of Mr. Gupta, to have been so kind to give me this opportunity to share with you what an accountable care organization is. And it actually fits very well, and the previous speaker spoke very nicely about accountability, and he spoke more from the patient standpoint, which is something that I will talk about in a little bit before I get into my presentation. A little bit about myself. I work for United Health Group. They are probably #1 healthcare organization in the country, mostly in health insurance and health services area. And it's roughly a $100 billion company, pretty large, with about 85,000 employees worldwide. We have a pretty big presence in India as well. So let me ask the audience, how many of you have heard of ACO, Accountable Care Organization? Anybody? Okay, one person. So this is good. So I'll give you, instead of making this a heavy, boring presentation, I'll give you some basics. So at least when you step out of today's meeting, you have a good understanding of what an accountable care organization is, and also what is the United States thinking about when they talk about accountable care organization. So let me move on to my first slide. What is an ACO? First of all, why do we need another acronym? You know, the healthcare industry is full of acronyms. What is really the need for another healthcare delivery mechanism? As in the last 2 days, we heard a number of speakers come in and talk about the costs of U.S. healthcare going out of control, right? It's spiraling out of control. And if we don't have a good mechanism, or in other words, if we don't have accountability in healthcare, there is absolutely no way it can sustain. Currently, I think U.S. is spending roughly about $1.7 trillion in healthcare, and it's supposed to go to about $2 trillion annual spend by 2020, which is alarming. So what really accountable care organization is, it was part of the healthcare reform of 2008. It was spelled out. So the idea was to create a group of providers who were able to accept accountability for providing care, quality care, and also to drive down cost. So that is very important for a predefined set of population. So it had to be about 5,000 patients or more in a given area, and with the ultimate goal of driving down cost, improving quality, and therefore improving outcomes. And if that organization was able to do that, there were also additional incentives that came with it. So it is a very good, it's a win-win proposition. In the first step, the accountable care organizations are mostly payers and providers. But what experts believe is in the future, patients would be accountable as well. So the word accountable really means someone having their skin in the game. So the doctors have the skin in the game, meaning they're getting paid for certain services, and they are accountable now for certain outcomes. Same thing with the payers, and later on, as experts believe, it would be the patients who are also going to be accountable, meaning, I'll give you a simple example. If there's a person with diabetes or pre-diabetes, the person has been diagnosed as a high-risk patient to become a diabetic patient. Now, the doctors have identified that the person is pre-diabetic, and obviously to take care of that, they have to lose weight, they have to take the medication if that's what is prescribed, and also exercise and lose weight. Now, it is very easy in the at least I'm speaking strictly about the US healthcare market, where the patients have certain entitlements, meaning the patient could as well say, I don't care about my diabetes as long as I get my medication, as long as I get my insulin or whatever, I'm okay. I'll continue doing what I always do, which is essentially not take care of themselves. So that is an entitlement. And entitlements could go away, and there would be accountability, meaning if they're not losing weight, if they're not following the regimen that the doctor has prescribed, they could be accountable, i.e., there could be some penalties. So either in terms of how much they pay out of their pockets, things like that. So that in a sense is what an accountable care organization is. So it was United Health Group. We launched a accountable care organization concept or a clinic in Phoenix, Arizona. I'll talk about it a little bit. Before I get into that, I just wanted to point out this is an IBM pictorial. I think it came out in probably just when the draft regulations came out in 2010. The final regulations came out about 2 months ago for what an accountable care organization needs to look like and how the care delivery models need to be, those kind of things. So what IBM predicted very, very well, that electronic medical records were an important component of an accountable care organization. So were healthcare portals, health information exchange, health analytics. So why are all these things important? 2 things make up an accountable care organization. One is good care management, and the second thing is patient engagement. So if you didn't have those 2, you cannot have a good accountable care organization. Care management, what that means is not only do you need good care management during events, healthcare events, or episodic events, meaning a person goes to a doctor's office for their checkup. That is an event. If the person goes to a hospital or if the person goes to an ER, these are all events. So it is not enough to just take care of the person during an event, but you got to also take care of the person between events, so they don't end up going into a hospital, going into an ER, which are the most expensive events and which is really what is draining the healthcare system, because it's so expensive to treat a patient in the hospital. So the whole idea is to avoid these expensive events, i.e. keep people away from the hospital, keep them healthy where they are, keep them, avoid patients going into an ED. So those are the primary concepts, and so with good IT systems such as electronic medical records, HIE, you can create this 360-degree view of the patient, not only what the doctor is providing in the form of capturing notes about the patient, but also the rest of the activities that happen for the patient between events, which is care management, a big component of care management. With that background, I want to tell you a little bit about what we have done. This is, again, the ACO that United launched. We went live with this clinic on 1/1/2011, and it's called LifePrint. And in the pictorial on the left, you see the care center right in the middle. That is essentially the clinic that you see down in the picture. And we've employed some chronic care doctors who specialize in care of patients who are 65 and above with multiple morbidities, with a number of not only medical conditions but also psychosocial concerns that they have. These are people that are considered high risk in a patient population. There are roughly about 2% that are high risk, and if you took care of them, you would essentially drive down cost because they are at the risk at a higher risk of going into these expensive events. So that, in other words, the care center is a resource for these patients to come in, consult, and also it's more of a team approach. Whereas you have a team, not only the team essentially comprises of an MD, a nurse, counselors, coordinators, and so forth. So the whole idea is to have people work on areas that they are very good at, i.e. doctors focus on the medical conditions, have counselors work on the psychosocial needs of the patient. Because in the elderly population, as much as the medical conditions are bearing down on them, it's the psychosocial needs are also bearing down on them. To address those two separately and have the doctors focus on things that they do best and free them to treat other patients. So that, in other words, more of a lean concept, if you will. So this is another pictorial about how the care teams are organized. You have the care team on the left, you have the doctor, you have a nurse, if you will, and then you have this patient services coordinator who, this care team is not, as I said before, not necessarily concerned only about the patient's health or the medical conditions, but also take care of things such as transportation. Have they had meals? Have they been able to pick up the medication? Because a lot of the elderly, someone else said earlier, they're comfortable in living in their own homes. They're not necessarily, they don't have the right structure in place where others can easily take care of them. So the system would, this kind of an organization would take care of the patients. Let's see. Again, one of the key things that we put in place is telemedicine. Again, to manage the patient between events, it was important, and especially for the high-risk patients, we put telemedicine units in their homes so we could interact with them. The doctors as well as nurses from the care center were able to communicate with the patients using telemedicine. So that was an important aspect of this offering. So in terms of investment, we had technology investments in telemedicine, technology investments in electronic medical records, HIE, portals. These were very important from a patient engagement and care management standpoint. How am I doing on time? Okay. Okay. So I'll quickly summarize. ACOs, they're here to stay. We'll see a lot more about ACOs in the next few years. As I said before, the final regulations from from the regulatory body came out 2 months ago. So people are trying to understand. This was at least in it was United's form of providing this ACO delivery model. And again, it's not a perfect model. We're continuing to improve it. We're continuing to alter it so that it becomes a pretty, again, it would allow for us to see the results that we would like to achieve. It requires technology investment, electronic medical records, HIE, portals, and telehealth for patient engagement. Care management, very important. That is not only the